All right, we're going to talk to Montana Senator, Mr. Tim Sheehy. Senator Sheehy, welcome to the show. Healthcare, you're talking about it in the Wall Street Journal today. Let me ask you, sir. Okay, Bill Cassidy, Mike Crapo want all these temporary Obamacare COVID bonuses to go directly to the individual, and the subsidy money could be put into HSA's health savings accounts. President Trump seems to be favorable to that. They would seed it with their various details and so forth and so on. What do you make of that? Can you live with that? Go to the individual, use the health savings, completely different idea than expansion of Obamacare.
Well, first of all, Larry, in case you didn't notice, the COVID pandemic emergency is over, so it's about time we start turning off the spigot on not even Obamacare. These are Biden-era COVID handouts that drove the cost of health care up. Let's not forget, since Obamacare was implemented, 247% increase in health care, and the increased Biden subsidies during COVID poured gas on the fire. What we need to start doing is getting the government out of health care, stop pouring trillions of dollars into a broken system where that money goes right into the pockets of insurance companies. And this interim plan that we've proposed that we're conferencing right now on the Republican side does just that. It says we're going to stop pouring trillions of dollars of taxpayer money into insurance companies, and in the interim, to ease the burden on hardworking American families, we're going to give those directly into HSAs to the consumers, so we do in fact start lessening the impact of healthcare costs on American families. Because what we've seen in the past 10 years has been when the government takes it over and subsidizes it writ large, coast to coast, we see massive increase in costs. That's objective. There's no arguing that. So we need to start doing long-term is find a way to bring these costs down. This is the first step in that direction.
So, Senator, I'm very sympathetic to your point of view. I take it, therefore, you agree with Messrs. Crapo and Cassidy. And my next question is, in the Republican conference, how many others, let's say, what percentage agrees with it?
Well, I think most of the conference is there. We'll see, of course, in the next few days if we're able to get to the 51 vote threshold we need. But I think the entire conference, I can say confidently, is united that we want a viable plan that starts to wean us off the Biden-Obama era subsidies that have driven health care to the precipice that it's at. American families are seeing premiums increase for the last decade, and they're looking at a forecast that those are going to continue to increase if we keep this broken system in place. So we can't change it overnight. We certainly don't want to cause premiums to increase any further than they already have in the past decade, but this plan provides an interim bridge to a point where we can start to bring common sense and free market solutions back to our health care and stop putting billions of dollars in health insurance companies, bring transparency to the pricing market for drugs and health care, and most importantly, return the relationship of the patient and provider to be the central point of healthcare, not government, not bureaucracy, not an oligopoly of healthcare insurance companies, patient-provider relationship. That's the core of healthcare. We got to get back to that.
I love that. You know, I was just reading the last point, Newt Gingrich. You talk about the affordability crisis, Senator. Yeah, it's about inflation and wages, but really, people are scared to death about health insurance, home insurance, auto insurance. All those costs have been going very, very high. Anyway, Senator Sheehy, we appreciate your time and your point of view. Thank you.